Hello and welcome to my December message. The first thing I want to talk to you about this month is the good news that our proposals for a big new 32-acre public park on the site were approved by the Planning Committee at Wandsworth Council on Tuesday night. This has followed extensive consultation that we've had with local residents, community representatives and staff and patients over the summer. And this approval really a fantastic achievement for the Trust because it's an important milestone in the development of the brand new estate, the redevelopment of Springfield and the building of 2 new hospitals at Springfield and Tolworth. So as you know, we've spoken about this before, about the brand new facilities that we will build on this site, some of the best inpatient hospitals in the country. So approval of this park strategy means now we can get on with the first phase of development and really begin the process to get a developer to work on the rest of the site. There's more information on the website, but we can expect to see some of the first building work starting in February or March next year. So the second thing I want to talk to you about is the continued pressure that we have on beds across the Trust and indeed across the whole of London mental health organisations. And I understand the pressure that staff are under day to day. I'm really pleased to say that the Trust Board have agreed to spend more money on this problem and have agreed for an extra £1.2 million to be spent this year on trying to alleviate the pressure that we have on beds and on the wards. And there's 5 things that we're doing to address this. So we've agreed to buy an additional ward for 3 months at East London Mental Health Trust. We're the only London Mental Health Trust to really have any spare beds. At the moment, when we need to admit somebody that we don't have a bed, we're having to send them to private hospitals or any other hospital that we can find. So the agreement to buy a specific ward at East London will make things a lot easier for patients but also our own staff as well. The second thing we're doing on this is increasing the number of medical staff that we have on the wards, and we know that that will help to speed up discharge and help with plans for patients when they're admitted. We've put more staff into home treatment and crisis teams to try and help the pressure in the community, and another initiative that we're doing is placing staff from housing associations onto wards to help speed up discharge and get people into the right, patients into the right accommodation at the right time. We've also, staff have been looking at crisis houses, crisis cafes and other facilities that trusts across the country have set up, and we're working with colleagues in the CCGs to looking at setting up similar things in South West London. Now I'm confident this additional money and the measures that we've been taking and putting in place will have some impact on bringing down the pressure for beds locally. So I'm very pleased to say that at our last Trust Board meeting we agreed to adopt the new values and behaviours that we developed this year as part of the Listening to Action project. And this is a really important initiative for us in the Trust. Now there's clear national evidence that organisations that have clear, shared, meaningful values that are focused on patient care really achieve higher quality results. And during the staff focus groups that we used to work out the new values and behaviours that we should have at work, there was unanimous agreement that having values that staff can relate to would improve how we work across the organisation. And we looked at 3 main issues. We looked at what it means to work in this organisation, how you display behaviours that are reflective of personal values, and really importantly, how do we challenge behaviours that may not fit in with the values. So we now have an agreed set of values and behaviours that we all need to use and follow while we're at work, and there will be lots of communication and information about these, how we use them in the new year. So please watch out for them. I think it's really important that we start to adopt and start to follow these values. So as you know, we're having a full CQC inspection next year. This will start on the 14th of March. And the CQC will look across the whole organisation and look at, are we providing high quality services? And there's been lots of preparation that's been done getting ready for this, and there'll be a major event during January where we'll have a full mock inspection of all our services, and that will involve staff from across the organisation coming out to wards, coming out to teams and using the same framework that the CQC use to assess the quality of the services that we provide at the moment. This will help us to understand where we need to improve and where the good things are and where we can share that with others. So this will happen in January. There'll be information published early in the new year about what's happening on that. And I look forward to seeing the results. I look forward to coming around and seeing more of our teams and our services so that we can be really ready for when the CQC arrive. So the last thing for me to say this month is really just to wish you a Merry Christmas and a Happy New Year. And a real thanks to all of the work that people have done this year. It's been another hard year, been a challenging year, but I think that we've achieved a lot in the organisation and have continued to improve the quality of services that we provide for patients. So those of you who are off over the holiday period, I hope you have a good break and enjoy the festivities. And those of you that are working, thank you very much, and Merry Christmas to you as well. Thank you. And this bit especially for all of our deaf colleagues in the Trust. Thank you.